It seems that the world is close to getting a vaccine for COVID-19, and distribution should begin shortly after a vaccine gets approved. But should people be required to get one as soon as they can? Ashar Qureshi looks for answers to that question.
Coronavirus cases are spiking across most of the country. Hospital ICU beds are becoming scarce, and a number of states are warning of potential lockdowns.
If they don't start to bend this curve, then it is clear that we're going to have to take more difficult measures and go to a stay-at-home order.
But this week, some good news. Pfizer concluded phase 3 of its vaccine study. The two-shot course, they say, is 95% effective against COVID-19. Earlier in the week, Moderna said its vaccine is 94.5% effective.
Based upon the preliminary data that is out there, these vaccines appear to be quite safe and very, very effective at preventing COVID.
If greenlit by the FDA, one question that may arise is whether Americans should be mandated to get vaccinated. In August, Dr. Anthony Fauci weighed in.
You don't want to mandate and try and force anyone to take a vaccine. We've never done that.
According to a Pew Research survey in September, about half of U.S. adults, 49%, said they definitely or probably would not get vaccinated. That was up from 27% in May.
I think it's going to be really important to build public trust before we talk about mandating vaccines for adults or even for children.
Tan points out that none of the vaccines have been tested in children, and so school-mandated vaccines could be years away. Still, legal scholars say local vaccine mandates have historically had solid legal precedent for enforcement for more than a century.
The short answer is yes, a vaccine can be mandated under the law.
Juliet Sorensen is a professor of health and human rights at Northwestern University's School of Law. She says it's still a complex question, not just about whether a vaccine can be mandated, but whether it should.
The Constitution empowers state and local governments to take measures in furtherance of the public health, as long as there's a basis in science for doing so.
And while few are endorsing a vaccination mandate right now, as the death toll climbs, without universal mask wearing and social distancing, it could be up for further debate. Reporting from Chicago, I'm Ashar Qureshi.